And we're asking whether the PM is being too cautious. Well, it turns out it wasn't always meant to be that way. It looks like Boris Johnson initially had other plans, but Sage warned there could be an extra 91,000 extra deaths if rules had been completely scrapped by the end of April. One blueprint said that they'd drawn up earlier this month allowed shops, beer gardens and outdoor attractions to be reopened by the end of March. Sage's argument that vaccines are not perfect and uptake will never be 100%, meaning millions of vulnerable people will still be unprotected. However, we also know that vaccines are very effective at keeping people out of hospital. So how does it all work? Let's talk to Professor Eric Brunner, who is Professor of Social and Biological Epidemiology and Public Health at University College London. Afternoon to you, Eric.
Good afternoon.
Is it meant to be this confusing? Is it confusing to you guys, or is it us non-epidemiologists that are confused?
Complicated rather than confused, I think, is the issue, because a pandemic is a complicated business,
True.
Especially when it involves a whole country, 70 million people. Some people behaving well, some people behaving badly. And remember that we don't understand the behavior of the pandemic in the population because it's a new virus. And just to give you an example of that, in the second wave, which we're now in the decline of, we've got much more disease in the population, many more deaths, many more people in hospital. And I just want to give you one statistic that on the 4th of July last year, 202 people were admitted to hospital as COVID cases. On the 18th of February, which is 5 days ago, 1,304 people were admitted to hospital. So right now, we are still in a much bigger epidemic than the one that we experienced last year. And this is part of the reason why Boris Johnson has had to be so cautious, because the disease is still still in the population. And he's doing a great thing. He's standing up against the ultra-libertarians and saying, we are not going to pretend that it's okay for hundreds of people to die every day for the sake of the economy.
But is there an argument, and I know this will be familiar with you, to you, Eric, that says actually some of those libertarians also have science on their side, because they're saying, well, hang on a sec, 9 out of 10 people who sadly die are over 70. 9 out of 10 people over 70 have had the vaccination. We learned yesterday that it could have effectiveness of 95% of keeping you out of hospital. So surely, despite the figures, and you quoted and cited a very powerful comparison between a few days ago and last July, but last July we didn't have all of these other factors in place, like vaccines, and vaccines that work really, really well. That's a game changer.
Yeah, I mean, you're absolutely right. But the point is that at the moment, we've got about 18 million people vaccinated, and it's not expected that everyone's going to have had their first vaccination until the 31st of July. So the modeling that was done that produced the figure of 90,000 excess deaths is based on the idea of having more or less an immediate relaxation of all the lockdown rules.
So like a worst case scenario.
So well, in fact, the worst case scenario was about 150,000 excess deaths, but this is pretty much a worst case scenario. And the factors that feed into it is the fact that not everyone will be vaccinated until August, the fact that it then takes 3 weeks for the vaccine to become effective. Then is the vaccine 100% effective? No, it isn't. Then there is the question that quite a lot of older people who are the most vulnerable are actually, and somewhat mysteriously, deciding not to have the vaccine, although I think the tide is very much turning in favour of the protection. Then the modelers, I think, probably are factoring the fact that it's possible that there could be some more transmissible variants, that there could be local outbreaks, because the higher the prevalence of the infection, the greater the chance is that you will have some of these, sort of downside events of the fact that the virus is still common in the population. So I think that the 90,000 sounds like a lot, and hopefully it will be. The fact is that even with what many people regard as an excessively cautious relaxation timetable over the next 4 months, that there will be excess deaths compared to the hard lockdown that we have right now.
And what do you make? It's a question I often put to scientists and clinicians too. And there's lots of confusion, and people make mischief with statistics, Eric, as you know. And, some arguments are very powerful, but they are merely one version of events, and there are other versions to look at. And certainly when we see these stats every day that are wheeled out from the government, often at those press conferences saying that X amount of people have died within 28 days of testing positive for COVID. And many people scratch their head and think, well, hang on, my Auntie Pam died of cancer. She happened to have COVID 3 weeks ago. She didn't die of COVID. She died of cancer. But according to those press conferences, she's down as somebody who died of COVID. As a scientist, what do you extrapolate from that? Can you explain that what appears to be a curious position from an outside perspective? That seems to be a fairly confusing picture for us.
Well, the issue of case definition lies at the heart of the science of epidemiology, and we have to use the data that are available to us. So the 28-day definition is a fairly conservative definition, in the sense that if you use the alternative definition of excess deaths, then the excess deaths since the pandemic began last March are somewhat higher, not very much higher. But you are absolutely right that many people will be dying with COVID rather than of it.
Yes.
And so this is an issue. But as I've said, when you look at excess deaths, the figure is quite similar. However, it is certainly true that people who have got acute disease, who maybe have got treatable cancer, who've had a stroke, I hope they will get the urgent treatment that they should be getting to prevent the bad effects of a stroke and to prevent death from stroke. But there are certainly conditions which are receiving poorer treatment than they would do. But what's the counterfactual to that? It is that we release the lockdown quickly, the NHS becomes overwhelmed, and the problem of poor care for people with non-COVID hospital conditions gets worse than it is currently. So unfortunately we cannot win unless we are diligent, unless we really fight this fight. And I don't like the kind of battle analogy very much, but the fact is that the virus is very transmissible, and we've seen this in the R values. And if we relax the social isolation, social distancing, then we are going to be in trouble, and people are going to have to be patient. And it is so difficult because as the sun comes out, as the days get longer, as impatience builds, as young people feel the stirring of their loins, whatever, it's going to get more and more tough. But we have got to stick with it and to try to beat the virus.
Do you understand, though, Eric, that just a final point, and not to go over again that point of how we define a death or what we put on a death certificate. But there is a lot of confusion over that. You know, it's the apocryphal story: somebody gets hit by a truck, but they happen to have had COVID, hardly knew they had it, but they go down as a COVID death. That is confusing, isn't it? I mean, is it reasonable to, even from the world of science, you must look at that and think that seems a bit odd?
I don't think it's odd at all. No, I don't.
So
agree
you
with
got
you.
hit, you died
I mean,
by being hit by a truck.
I'm sorry. I'm sorry if I'm sorry that I don't have the figure to hand, but there are many people who are dying as a direct result of the infection. We know about the people who we've seen daily on the TV who cannot breathe and who are being intubated. Those people cannot be ignored, and neither should the
I get that.
People working, neither should the people who are working in intensive care units,
of course,
who are fighting to keep people alive who cannot breathe.
I think we all understand that, and it's important then in that case, what I take from what you're saying, Eric, that just because you didn't die of COVID, and some people would have just simply COVID, nothing else, they died, and that's terrible. But dying with COVID, as distinct from of COVID, doesn't mean to say that COVID played no part. It's clearly, it could be a huge catalyst in your accelerating your death. Yeah,
there could be an interaction. But I think the most important thing of all is the attitude that people have. That, you know, if people want to pick holes in the statistics and say, you know, this epidemic, you know, is being exaggerated or it doesn't really exist at all. I mean, I don't know what planet those people are on. I really do not.
I would agree with that, but I think the steamroll, you know, being hit by a truck analogy is probably the kind of thing that perhaps sows that seed of suspicion, because it would be weird if you were perfectly healthy, happened to have had COVID, got over it, everything was fine, hit by a truck, and you go down as somebody who died with COVID. I mean, that's technically, it's still in your body. That doesn't really define the story of your death.
No, it's quite true. And what we have to think about is that epidemiology is about statistics. It's not about individuals. And that there will also be people on the other side of the equation who die as a result entirely or partially due to COVID, who are not recorded as COVID deaths, although in this country that number is pretty small. So what we have to do is we have to look. What we have to do is we have to look at the thing in the round, and there is really no better definition. I mean, we in this country we are very good at collecting health statistics, but nevertheless there have been very careful examinations comparing us with other countries.
Sure.
And what is clear is that our death rates are among the highest, but they are certainly at the same approximate level as in other countries in Western Europe, for example, where we can make a direct comparison. So there's no way around it.
So it's excess deaths that we need to look at, if you like. If it's a case of satisfying ourselves of the severity of what is happening, that would be a figure that would lead us to that conclusion. Eric, thank you. I step in there. We could talk for a lot longer. I know this does hugely divide the room, as we've already discovered with some of our texts and emailers who are not so kind to some of our wonderful contributors. But thank you anyway.